You don't, but you do strike me as a little bit me defensive on all this. We really want answers as a collective
Well, it's
group.
hard when you get your fault based now on Obamacare and socialism. I'm not saying you might,
no,
but
I
listen.
understand it, but don't be that defensive because you're here. Okay, but
And I've been all over this county.
good for you. I mean, I don't vote for you, but I respect you. Good for you. Okay, but there's a couple of things that don't make sense. Kind of what this gentleman says, because the big problem we have now is a 26-year-old, okay, working, doesn't want health insurance, in his life, he has his appendix, or he had braces on, he's going to go to the emergency room. They're going to have to take that. Okay, they're not going to turn him away, even after all this is said and done. He's going to get a $25,000 bill, he'll declare bankruptcy, and they're stuck with it. So nothing's going to change in that respect. So,
I don't agree with your comments, Mike, but I don't want to cut you off.
no, I mean, nothing's going to change in the respect that we're still going to have to care for the people who refuse to buy insurance and don't want to pay for it.
But not sure. I'm being respectful.
See, here you get a little bit.
Because I want to make sure I hear you.
You're not disrespectful. Just say what you have to say.
Okay, part of it is that we call them the young invincibles.
Yeah.
You know, young folks that say, well, I'm never going to get sick.
Yeah.
Well, they get sick like, oh, they break their arms, they get, you know, and the problem is that they go in, the number one leading cause for bankruptcy is because of medical bills. And some people will say, well, we shouldn't touch anything. Part of it is making sure.
Here's the problem you got.
Okay.
The problem you have is that we're counting on these young invincibles in the scheme of these bills, okay, to offset the cost to pay for these bills. If we can't get all of the under 30, under 35 crowd to sign up for the insurance vis-a-vis their employer paying the $200 a month, we can't run any of this.
Right.
Okay, that's a fact.
That's why we're pushing them in.
Yeah, but what the
to
gentleman was saying, I wanted to, okay, is that you're saying that there's only a limit to what we can do. We can't jail these people, we can't, garnish their wages. There's
Well, that was
always
the premise of the question, that they're going to go to jail and sometimes.
yeah, we can't do any of that stuff. We're not going to do it. So what's going to happen, it's a sheer numbers game, is we're not going to have enough money to fund anything that you want with health care, whether you or I agree with it or not. It can't be funded because that pool is not going to come in to do it. Last thing
But I would disagree with you, Mike. And again,
we can do that in private.
all right, but for everyone else, 30 million people are going to go into the system, including those young invincibles that you're referring to.
Yeah, but they're not going to pay.
But no, they have. We're mandating. Everyone has, and that's part of the deal here is that everyone's going to have to go and get health insurance, not government health insurance. Health insurance.
But
Okay.
what he's saying is they're going to refuse. They're going to do just what they're doing today. In other words, here you're saying they're going to have to, and this guy and I'm saying they're not. Okay, that's human nature. They're not. Now the next thing is
They have to pay fines
I
to
get
the
jobs.
government
I get
if they
jobs
don't.
for people for a
So
living.
then instead of being indebted to the emergency room, they'll be indebted to the government.
I get jobs for
Don't
people.
get the garners, their wages garnished. Don't get the wages garnished.
But the Constitution
Okay.
makes something.
I get jobs for people for a living. That's what I do. Okay. Now the biggest problem I see, and I'm an expert on
Make
this,
sure that the patrons get charged the same.
is you got a whole group of people 40 and over, and those are the people that have been let go. The 80, 100, $75,000 crowd right here in this county, okay? And they are absolutely out of work 7, 8, 10, 12 months, and they have, well, 13, I think I hit a nerve here. There's absolutely no chance for these people to get the same jobs that they lost, and they're getting so desperate. I have them crying on the telephone to me. I had 2 yesterday, break down in tears. And I can't help them, I can't tell them anything, and there's nothing they can do. They had jobs that had one skill, the skill is gone, and the skill can't be replaced at their age, and they're going to be chronically unemployed. Yet we're making shovel-ready jobs. A 45-year-old guy from Yardley isn't going to go out and do road work, okay? But that's not where the problem is. The problem is the 40-year-old guy who just got kicked out of Qualcomm or whatever. I mean, and that's where we have a problem, sir.
Yeah. Can I just mention that? And I agree with you. Part of the things that we're looking at now is that a jobs bill coming up forward because there's still, unemployment potentially. We're still trying to get ourselves out of this recession, and we're trying to partner again with the private industry. This isn't a government run. And now I'm looking at it. I'm still trying to. So I wanted your feedback. So we'll talk offline. What about if it's a new job where, a new job tax, if you hire a new employee, meaning you get a tax credit? these are things that we're looking at as far as from the federal government side. Partnering with private industry, say, if you hire that guy that you're talking about, in whatever capacity, that's 70,000, 80,000, or 40,000, 50, whatever it is, that it's a new job that you're creating within the next few months, so it's temporary spending, that they were going to tax credit. That's something that I'm interested in looking at. Of course, I want to make sure, how we're going to pay for it as a temporary, etc. But I think part of that is
not to be contrary to you, but the problem you have, and I'd be glad to talk to you.
And I want to partner with you.
The problem you have is they're not cross-trained to do anything else. They have skills that are 5 years. Their jobs have been carried for 5 or 6 years. They're now obsolete. These are people with education, with training, that are not trained to move into a new field. We specialize them so much, they're dead, especially our IT groups. IT people are just suffering in mass, and that's a big thing up here. Another problem you have is you got age discrimination with the employers. I fight this all the time with my employers. They pretty much, and I can't tell me they won't hire anybody over 40. How's that? Now I got to make a living, so I'll do what they want. Okay, but they are the biggest problem. You ought to start a committee there in Congress to discuss age discrimination and throw some of the bastards in jail who won't hire a 45-year-old guy and want to hire a 25-year-old guy.
That might be constitutional.
No, but I mean that's a big problem. One of your biggest problems.
You're out there every day, and I want to partner with you. Okay, and part of this is that I'll give my card out there.
But that doesn't mean I'm voting for you.
But I still am your congressman. I'm still trying.
We have a mutual friend.
Who's that?
Timmy Macklin.
Oh, I'll have to talk. Let me on him and tell him.
Timmy's one of my best friends.
But
I'm gonna
Pat,
talk
why does that
So-
patient that he said in the beginning get the $25,000? Excuse me, $25,000 bill. Why doesn't he get the $4,000 bill that Medicare pays the hospital for that same insurance?
Couldn't pay that
Why?
either.
Because the government mandates that everybody get charged the same, although that person doesn't have a.
That's actually not true, sir.
Yes, it is true, and they don't get it, and they don't have a contract. Medicare has a contract with the hospital. Blue Cross has a contract with the hospital, but Joe Smith doesn't have a contract with the hospital, so he gets a $25,000 bill when that same bill would have been satisfied
Right.
by $4,000 by Medicare.
And I'm for that. Why doesn't everyone just get the same and make it transparent?
Exactly.
I'm for that transparency. So you and I don't have a disagreement.
The point of the question was whether it was 4,000, 40,000. See, these people don't have $5,000 to their names. It's in their new truck in the driveway.
Yeah.
They don't want to
They
pay
got
their
with the
bill.
clunker
And so I'm
money?
They don't
gonna
want
go
to pay their
gentleman,
bill.
And I'm going to talk